hate working in healthcare. I hate it. I hate it. And you know what? That's why I put money in the AI companies. I want them to take over. I do. Oh my gosh, you're so selfish. Do you know what would happen if AI just takes over? Do you know what happened to the human race? I do. I know what's going to happen. We're all going to be forced to make it work. I know what's going to happen. I put money in AI companies. I do. I love doing it. I don't care. I hate working in healthcare. I hate working for other people. I hate it. I said it. I hate it. I hate it. I'm going to lay it all out tonight. Second video for tonight, by the way. Like, comment, and subscribe. Thank you. Yeah. So, let's start from here. You got to get up. You got to go drive. Oh, no. Let's get ride. You got to get up. You got to get ready. That takes forever. Get out your house, you got to get in your car, you got to go drive, you got to go sit in traffic, go sit on the busy-ass highway. Oh, it's an accident, it's going to be a 10-minute extra wait. Oh, 20-minute extra late. Then you're late, oh my God. Then it starts raining, then you're even more late, and then you're wet, and then you have to run inside, and you got to go inside, and and then because you work in healthcare, you got to work on weekends, you got to work every holiday, because you are an essential worker. I'm sick of it. I go in there, I have all these patients on my ass. As soon as I walk in there, I need this, I need that, I need this, I need that. You know what working in healthcare, working bedside healthcare is like? Remember when you were younger and your mom would keep calling you into the room? Hey, Johnny, come here. And then you come and you're like, yes, Mom. And then she's like, give me the remote right there. And it's right there. That is exactly what bedside working in healthcare is like. They are calling you for every little thing. Everything they would do by themselves at home, they calling you for because you're right there. I don't know if it's loneliness, because you're depressed or whatever. You keep calling me in your room. You keep telling me your life story. I just don't care. Like, you think this company paying me millions of dollars? I don't care to hear your shit all day. Like, go have a therapist. Like, everything I want to say, I'm just going to say it here. This channel is my diary. And I told y'all that before. I just say shit because I'm like, I just hate pretend. I just want to let it out. I'm so sick of just caring. I have to, like, overly care about a fucking stranger I don't even know. And when they get discharged, the doctor puts a discharge order and they go home. They're going to forget about all of us anyway. They're going to be on TikTok and they're going to forget about all of us anyway. Like, what is this all for? We have to kiss your ass because you're giving us insurance money? Is that why? Because you know all the insurance money you're paying that you think is going to us is really going to the CEO, and then it's trickling down and then we're barely getting anything at the end? By the time the water trickles down, is only one drop left to us? Like, do you know that? We are taking care of like 10, 12 plus people at a time. And they're constantly calling, and it's constantly something. And you got to go to CT, and you gotta push all these machines. You got to push these heavy ass beds, heavy ass equipment. IVs going off, alarms going off. People coming out of bed, the bed alarm coming off. Every second, it's like you can't leave the floor for 5 minutes. You leave the floor for 5 minutes. Here go 10 people calling you. Here go fucking telemetry calling you. Oh, the person's five lead EKG is off. Oh, this person fucking what is it called? Like the O2 shit on the him. I'm forgetting it right now. I'm forgetting the name. The fucking whatever, you know what it is. If you work in healthcare, you know what I'm talking about. The damn O2 is all over the place because the shit on their hand is coming off. And the pulse oximetry, the pulse oximetry is off. It's just like, oh my God, like, and then people are it's just like, you have to clean these people. You got to take them to the bathroom. When they throw up, you got to clean it. When they do number 2, you got to clean it. When they pee, you got to clean it. It's like every bodily fluid you got to clean. You got to keep going. And then they pulling the IVs out. And then it's just like, and then niggas got to go fix that. It's just like, it's just exhausting. And then it's like, when you look at the amount you're getting paid, and you're like, bro, like, none of us is getting paid enough. When you look around and everybody in the job is miserable. All the doctors are miserable. Like, they could care fucking less. They just put the order in, all right, bye. Like, they're just gone because they hate their jobs. They're in mountains of debt from schools. They can care fucking less. They just want to pay off their debt and go live their life and just be done with this shit. The nurses are miserable. The assistants are, everybody's just miserable. You can just tell everybody's complaining. Everybody wants to go home. Everybody's like, why do I come back working here? Everybody's quitting left and right. The hospital is hiring over and over like McDonald's. Every month they're hiring like McDonald's. It's like, because nobody wants to stay there and do all this physical, demanding ass work. And if people be like, oh, but we heard some of y'all work 3 days a week. That should be good. Bitch, if you don't work in healthcare, don't say that, because you don't work in healthcare. You don't know what it's like. You don't work in healthcare. And a lot of y'all, you know what's so crazy? Everybody that works in healthcare, every time we say we hate our jobs and we hate what we do, or we wish we can get paid more, or we wish that, we don't like this, we don't like that, people always want to try to come after us and say, oh, well, thank God you're not, or thank God, one day you don't want to work in healthcare because we don't need people like you. And then thank God this, and well, you should just deal with it. Bitch, shut the fuck up. There's always some people who don't even work in healthcare. Everybody that says that, they never work in healthcare. They always work a fucking office job, or they work security, or they work like in an office. Like they never worked in healthcare ever. You have a sister that works in healthcare, or whatever. You don't work in healthcare, so you cannot tell somebody who works in healthcare how to feel. You don't work in there. You never will. You don't even help them people, so you don't understand what the burnout is like. You don't get it. You don't get it. You don't have to risk. You don't have to risk your life every time you go in there because you have a psych patient every day and they go, man, they might hit you across your fucking head when you ain't looking. Or you got to be in rooms of COVID and flu and MRSA and the list goes on and on and on. You don't have to be risking your life and your health every damn day just to make $1. You don't have to do that. You don't have to come on holidays because you work an office job and you're off on the holidays. We have to sit on the holidays. You don't have to be here when there's a hurricane because we have to be on either list A or list B. Because either we work day shift or night shift when hurricanes come. When hurricanes come, guess what? We still gotta go. When it storms and it rains and it pours and it all in the hail and all the snow, we still gotta go. Like, you don't have to go. You can call out. They close it out. We have to still go. You don't get it. And I hate when people tell somebody in healthcare how to fucking feel. You don't get it, bitch. So don't speak on it. But you never worked healthcare and you never will. So don't tell somebody how to feel. You know what I hate the most? The fucking family members. They come in there and they stay the night and they're annoying as hell. And they want blankets and sheets and pillows and all this shit because they're staying the night. You're not a patient. Go home. We don't get paid to take care of family. We don't get paid to take care of you. We don't barely get paid enough to take care of your fucking mom. But we're taking care of your ass. Like, then on top of that, and you here, you don't want to help with shit. Your mom does shit, and guess who has to clean it? Us. You don't clean shit. We gotta fucking do it, bitch. You don't clean shit. Oh, my mom's diaper needs to be changed. Oh, my mom put out her IV. Oh, this, oh, that, oh, that, oh. And they don't help with shit. But they want to micromanage and they want to be on somebody else. They didn't want to ask for food and tea and juice and water. And they want to ask for all these things. But guess what? They're not a patient. Why are we taking care of you? We don't get paid to take care of you. Let me tell you this right now. Let me tell you something that all the nurses, all the doctors want to say. Go home. Go home. Go home. The family members, go home. Go home. Go home. Go home. Go home. Pay the parking fee and go home. Go home. This is a hospital. This is not a hotel. We're not here to cater to you. No, get home. Go home. Go home. Go home. Go home. We don't want you here. Okay? It's annoying as fuck. That's number one. Number two, they want to start yelling at you. They want to start calling shots. The amount of people I had to ignore because they thought because I worked that they could talk to me crazy. The amount of people I wanted to strangle in that fucking hospital. God help me, God. The amount of people I wanted to literally put to a grave in a hospital. I swear to God. And I'm not talking about the patients that are nice. They're walkie-talkie. Because y'all walkie-talkie, ain't no times 4. Y'all ain't no times 4. Y'all walkie-talkie. Y'all can do things on your own. We love having y'all because guess what? Y'all not a damn burden on our life. Y'all are not a burden. We love a walkie-talkie ass patient. We love a patient that could shower theyself, bathe theyself, that could do their own shit and make their own bed. We love y'all. We love y'all down. I ain't gonna lie. Because y'all make our lives easier. Them people that's bedridden, girl. They bedridden, they got an attitude because they miserable in that hospital bed. We got to do everything for these motherfuckers. These 300 motherfucking pound plus bitches in that motherfucker. They lay in the bed all day and they talking about, can you pull me up, baby? Me and the nurse and everybody else sitting there was looking at you like, what the fuck you mean pull you up, bitch? You like 300 pounds, bitch. We ain't pulling you up, ho. We gonna put you in Trendelenburg, which is where we basically put the bed up into the sky so that the gravity could slide you down, baby. Pull the rails and pull up, bitch. We ain't pulling you up. You 300 pounds, baby. We ain't pulling you up, honey. You big as fuck. I ain't gonna lie. No, ma'am. But anyway, I ain't breaking my back for nobody in there. They gotta get out of bed and they want to hold you by your wrist. I move my wrist fast as fuck. You ain't holding me there. You ain't finna break none of my bones in my body, bitch. You crazy. You ain't putting none of your weight on me. This ain't the gym, bitch. Ain't no weight bearing nothing. You ain't putting your weight on my ass. Go ahead and grab that motherfucker walker and put your weight on that. You ain't putting your weight on me, bitch. Not for this money they give me. You crazy as fuck. No, ma'am. I can't do healthcare. The amount of shit you gotta smell and all, I ain't with all that. Y'all be smelling crazy. I gotta be yelling at y'all. Go get up and go take a shower. I gotta be telling y'all, hey, get up. Like, go to CT. Like, get up. Let's go. Like, oh, I need to sleep. You was sleeping all day. Get up. You're not here to sleep. Like, I'm very, like, I'm nice, but I'm cutthroat at the same time. Like, get up. Like, you're not here to be sleeping. Like, get up. Like, you got, the doctor put an order and you gotta get up. You gotta get up. I wheel your ass down to CT. You get your CT scan, your CT head scan, and you go to MRI. We wheel you down to MRI. You got to get out of here. Like, you can't be in here all day. You want to live here and shit. No, you got to go. The doctors don't care. They discharge order. They discharge order quick as fuck. They don't want you on. Y'all got to go. Nope. You not here to chill. You not here to relax. This ain't the Ritz-Carlton. It's like the Four Seasons, baby. You got to go. We ain't about to be giving you food and catering to you all day, wiping your feet and all that. No, bitch, you got to get up. You got to go. Get up and go. Get up and go home, Roger. Go home. Anyway, so the next shit, it's the truth, but the next shit, every time something go wrong, if they order a tray and the food tray is wrong, I gotta go run downstairs and go get food that's right because dietary messed up or the doctor didn't put the order in for the other type. They were NPO and then they nothing by mouth because they had surgery or whatever. They were having surgery and then the doctor doesn't put an order in for regular diet, so they miss their tray, so the people don't deliver a tray because they think they're NPO, and then they get no tray, and they get no food, and then they come to me, and when I clock in, like, oh my gosh, I didn't get no food from day shift, they shouldn't give me food. Why does day shift problems have to be on night shift problems? Like, why is that my problem because you didn't get a tray? You waited until I come in. Why you don't ask the last person why you didn't tell them you didn't get a tray? So now I gotta go to the fucking cafeteria and go get your ass tray. Go walk. It's just like, oh my God. Like, I'm just so over this shit. I'm so over working. I just don't want to work best. I don't want to work in healthcare. I don't want to work with patients. I just don't want to work with it. I don't want to work with the family members. I don't want to work with the annoying ass family members. I don't want to work with the annoying ass patients that steady complaining, steady talking shit. I don't got time for y'all. Y'all lazy as fuck. Y'all don't want to pour y'all own water. Y'all don't want to pull up y'all don't want to pull up y'all own blanket. If the blanket is at the end of the bed, y'all don't want to stretch to pull up. Y'all want us to come. Y'all keep calling us every little thing. If you want the bed up, you calling us for that. The button is right there. The fucking arrow that's going up, and you can just press it and the bed go up. Nope. You want to call me to put the bed up. You want to call me to pour the water. You want to call me. It's just like, you calling me for everything. Like, bro, like, do you do anything by yourself? Like, people are a burden. I hate working with human beings. I hate working with people. I cannot wait to work for myself and to get out of this fucking shit. Like, I do not want to work with these fucking people. I don't want to work with y'all. I don't want to be your maid all day. I don't want to be kissing your ass. I don't want to be cleaning up no body fluids after you. I don't want to be smelling your ass. You take a shower in 5 days and I gotta be yelling at you. Go take the fucking shower. I don't want to take a shower. Go get up and go take a shower. You stink. Like, why you think I'm telling you to go take a shower? You stink. You stink. You stink. You stink. Like, you got surgery, you don't want to take a shower. We give you the antibacterial soap, you don't want to take a shower. Like, get up and take a shower, you stink. You're like fucking 50-something. You're older than my fucking mom. Like, you're like 40, 50, 60, 70, 80 years old, and I'm yelling at you to go take a shower. You stink, my nigga, you stink. Like, and that's why I'm telling niggas to go take a shower. Niggas want to take a shower. Niggas don't want to brush their hair. Niggas are lazy, niggas are burdens, and niggas want to be on me all day. I'm tired. I'm so tired. This is why everybody quit. This is why everybody quit this job. This is why everybody quits. Like, I see why every other day is a new person working here. Because nobody wants to work in this shit. Everybody hates it. Everybody's miserable. We don't want to deal with y'all. And, like, I'm so tired of working in healthcare. Everybody want to say it, but everybody afraid to say it. These patients are annoying. Let me describe it. When you work in retail or you work on the phone or at a call center, you know those people that are rude and you call them Karens? When they get sick, they come to us. We take care of the Karens. Yep. We take care of the Karens. So we feel exactly how you feel. Just because you work in healthcare, don't mean we have to be nice. We gotta kiss your ass, and we gotta. Oh no, we can't say that. We can't because we work in healthcare. We can't say that. No, bitch, you're annoying. You're annoying. You're annoying. You're annoying. You're a burden. You're annoying. You're annoying. You hit the call out every second. You're annoying. You're annoying. You're annoying. Like, I don't know why people like don't want to say shit because I work in healthcare. No, bitch, you're annoying. Like, they think it's a hotel. It's not. They call for shit all day and like they complain about everything all day. It was one white guy that fucking annoyed the fuck out of me last week. I don't give a fuck. I'm gonna say it. Cause he ring the call light and I went in there. I said, how may I help you? This him what? And I said, sir, I'm gonna tell you exactly what I said. Sir, you hit the call light. And he was like, oh, okay. Like, bitch, you called me. Like what? You slow bitch. I was like, all right, whatever. So I go in there. He's like, yeah, the Foley is leaking. I'm like, ain't no way, ain't no Foley leaking. That shit ain't no Foley. I'm like, I look at it. I'm like, it's a condom catheter. If you don't know what a condom catheter is, it's basically like, you know, the condom that you use to have sex. The condom, we put a condom on the penis, and the condom has an opening at the end, like it's open, and it's like little plastic or whatever, and we basically connect the hole at the end of the condom, like the little plastic. We basically stick it onto a tube, like we connect it to a tube, and the tube goes into a bag. So basically, when they pee, it goes into a bag, and we empty it out. So it's easier, so they don't keep peeing off the bed. So it's easier for us, and they sit under a little pad, so that it doesn't wet the bed. Easy, whatever. I said, oh yeah, the condom is leaking because they didn't give you the right condom size. The condom is too fucking big, so the fucking urine is going all over the place. I said, all right, bet I could change it. I get a smaller condom, right? Because this shit is small. No shade, no, not trying to be funny, but it's small. I was like, all right, cool. I go get the smallest shit we got. So I come back to the room with the new condom. I'm about to slide it on. So I pull back the blanket. And I pull up his hospital gown. He's like, my penis is right there. My penis is right there. My penis is right there. You don't have to lift up my hospital gown. And I said, sir, your hospital gown is covering the penis. So I have to move your hospital gown up so I can see your private part. Like, what are you talking about? I can see your little shrimp. Okay? Your shrimp with fucking pubic. I can see that shit, bitch. Dumbass bitch. So he was like, oh, it's right there. He was all yelling. And I said, I dropped everything on the bed and I walked right out. I just walked right out. I left his hospital gown. I didn't give a fuck. I said, oh yeah? And I took off my glove. I said, shoot. And I put it in the garbage. And I went out and I said, I don't want this patient declined. And guess what? They had to change it. And then they sent you a man to put on your condom. How about that? Let's do that. I'm not dealing with none of y'all no more. I walk around the room. I put my hands like that, and I said, oh, yeah? And I took my gloves off, and I said, not dealing with you. I don't get paid enough. I said, boo, bye-bye, boo. Bye-bye. I don't get millions dollars a year to work here. Don't. None of us do, and I'm not dealing with it. They could deal with you. I ain't dealing with you. Ashley not gonna deal with you, but Susie will deal with you. I ain't dealing with you, bitch. Robert will deal with you, but I ain't dealing with you, hoe. So I was like, oh, yeah, really? Oh, yeah? And then when I was walking out, just do it. You could just do it. I said, no. I said, it's done. We're going to find you somebody else. Thank you. And I slammed the door. I said, whoop, boop. And I closed the door. And I went to the charge nurse and I was like, don't want him anymore. Thank you. Find somebody else. I guess they did. Find somebody else. Who you think this is? Who you feeling like? Who are you feeling like, old ass man with balding, bitch? Balding ass old man. Who do you feel like? With your small ass, who you feel like? That small ass dick can see your legs. You mad because your dick's small and you in the hospital bed and you miserable? You in the hospital bed and you're miserable, so you mad at a young bitch like me? Bye, bitch. Have a good day. And I was like, oh yeah? And I left, bitch. And I left. I ain't got time for that shit. I ain't got time for that shit, bitch. So, yeah, so I fucking left. Yeah, so I'm sorry, I was looking at something, but because it's raining and shit. But yeah, so I left or whatever, and they deal with it. I'm not finna keep dealing with his dumb fucking white ass. I'm not finna deal with you white balded ass bitch. I'm not finna deal with you, bitch. The fuck? Who the fuck you feel like? Even when he had an attitude, like he miserable as fuck. I don't want to take care of miserable people. When people are in the hospital, they're miserable, they're upset, they gotta pay all these hospital, and they miserable as fuck because they gotta pay all these hospital bills and they gotta do all these exams and they're miserable as fuck, and I get it. But you think I want to be here? I'd rather be going to Chanel and shaking my ass on the yacht. You think I want to be here with you, taking care of you? Mr. Robert, do you think I want to be here with your old ass? Be serious, like, be serious. Like, the fuck? Like, stop. Like, I don't want to be here with your ass. Like, you don't want to be here, and we don't want to be here either, but guess what? We got bills to pay, so we got to be here. Like, the fuck? You talking to people crazy, like, bitch, I don't want to be here with your old ass, bitch. I hate that pretending shit. I want to be here with your old ass, your saggy ass. Like, your miserable ass, and because you're miserable, you want to be rude to me and yell at me. I ain't finna be dealing with your old raggedy ass, bitch. Fuck out of here. Y'all be raggedy and annoying as fuck. A lot of people hate working in healthcare, but we have to do it because we got fucking bills to pay. You think the nurses want, them doctors want to be in taking care of you? No, they don't. They rather be at fucking home. They don't want to take care of you. Like, the fuck? You think all of us want to be at work for 12 hours slaving, running around all day? Nobody want to keep doing that shit for that money, bruh. Y'all be delusional as fuck. I'm over this shit. But yeah, like, I hate working in healthcare. It's no point if I hate it. I fucking hate it. You gotta kiss these people ass because their insurance is paying us. Like, that's why you gotta kiss their ass. Like, girl, no. The amount of people that have called me, I'm sitting here cleaning stuff off. Like, I'm just sitting here cleaning after them every second. Every second they pulling out IV, they pulling out, like, they pulling off the electrodes off their chest, the little sticky things they put on your chest to, like, put the EKG, that thing. They pulling it off. Every second it's falling off. Every second, the telemetry people keep calling me, oh, he took it off and we can't see it, and it shows a systole. I'm like, he ain't dead. Ain't no fucking systole. It's showing a systole. Oh, can you go check? And then every second, it's like, I'm just, oh my God, you have to deal with these people. You got to smell these people. I'm just so sick of working. Healthcare is just such a nasty ass. It's nasty and just belittling. I'm just so sick of working in there. And I can't wait to escape. I'm so sick of this shit. Exactly why I work on my own shit. I just hate working in this stupid damn job. Like, I'm just so tired of dealing with these fucking annoying ass patients, these annoying family members, and just everybody working so hard to get nowhere. Like, I hate working in healthcare. It sucks. It's a lot of patients that were in there that were abusing the call light a lot, and everybody else hated them just as much as I did. And every second, every second the call light, every second the light was going up, every second the light was going up. I'm like, what the fuck did this nigga want? I said, you know what? All y'all scared to talk to this man. All y'all talking shit about him at the nursing station. Let me talk shit to him in his face. That's how bitch I am. I said, okay, yeah, let me come to your face and talk shit to you. Alright? Fuck the nursing station. Fuck the nursing station talking shit about the patient. No, bitch, I'm gonna come to you, bitch. Y'all can talk shit. He called too much. He ain't knowing this fuck. No, bitch, I'm gonna go to him. I said, I opened that door. I said, sir, you calling again? They seemed like, yeah, I'm calling. I said, what do you need now? Yeah, I just need one more blanket. Sir, you have 10 blankets, sir. The AC is on max. You have 10 blankets, sir. You have 10 blankets, sir. Like, we can only give you so many. Do you think you're the only patient in the hospital? How many blankets? You think we have 200 blankets in the warmer? Huh? Like, no, we don't. It's other people in the hospital too. And their family members in there too. And they all want blankets. You take all the blanket, ain't gonna be shit left. Like, and I told him, and I said, sir, you are abusing the call light. I said, sir, you are abusing the call light. This him, I'm abusing. I said, yes. I said, sir, everyone is saying outside that you are abusing the call light. You are calling too much. Sir, you are in the hospital. You call for the emergencies. You do not call because you feel like calling for every little thing. You are A&O times 4. Alert to person, place, time, situation, all that shit you are aware of. Place, situation, time, all that shit. You are A&O times 4. You know what today's date is. Shit, you know what you did 10 years ago. You know what you did. You are a very alert patient. You are here because you broke your leg. And you think you're supposed to kiss your ass all day. You are abusing the call light, sir. You are. You blood clot, pressing the call light, too many blood clot time. People can't angle it, alright? You are hitting the call light too much, sir. Sir, hello? Sir, hello? Wake up. You hit the call light to blood clot much. Yes. They might chat shit at the nursing station. At the nursing station, they might chat shit. Y'all talk too much. Y'all call too much. Y'all do too much shit. It's too much for us for angle. We can't angle it. We can't. We cannot, sir. Sir, please and thanks. Stop it in the blood clot, all lights, please. Yes. You're too blood clot fisty. Stop hitting the call light, sir. Like, I'm sorry, I wanted to call. Thank you, sir. And I close the door and walk out. I'm tired of it. Y'all are abusing the employees. Y'all are abusing them. Stop calling for every little thing. It's annoying. You are a grown man. You're old enough to be my dad. Do it yourself. Like, we are not a hospital that wants patients to be dependent. We push independent patients. We do not want people to be dependent on us. When you go home, who's going to do it for you? Your dog? Like, your dog is going to do everything? Is your poodle going to do, your poodle that has no service training, is he going to do everything for you? No. Is your dead wife going to do it? No. Get up and go do it. You're a grown-ass man. Get up and go do it. Like, stop calling us for every little thing. It's annoying. I'm sick of it. Like, I'm so sick of it. Like, oh my gosh. When anybody in healthcare hates their job or like they don't want to work in healthcare anymore, we always get so much backlash. Oh, well, you should. And, oh, well, yeah, you should care. You should overly care about strangers that don't care about you. Yeah, well, you should. And you should do this. And you should. If a cop say he hates it, nobody cares. If the judge says she hates her job, nobody cares. If the cook says he hates being a cook, nobody cares. If the lawyer says he hates his job, nobody cares. If the cashier says she hates her job, nobody cares. Every other profession, nobody cares if they like it. Nobody cares if they're depressed. Nobody cares if they want to leave, if they want to quit. But every time it's people in healthcare, we have to just deal with it. We can't complain. We can't voice our opinion. We have to be quiet. Everybody else gets protection. If the Karen yells at you at your job, she gets kicked out. She gets trespassed. If the Karen puts her hands on you, you can press charges. When you work in healthcare, don't press charges. They're a patient. They call you bitches and hoes. Oh, don't say nothing. You work in healthcare, just deal with it. Every time people work in healthcare, nobody wants to. They want all of us to stay quiet and not have emotions and not say nothing. But every other profession can say they don't like it. Every other career, they can say they don't like it. They can say this. They can say that about it. People that work in the warehouse, they can say they hate it. But every time somebody in healthcare say they hate something, it's a problem. Fuck y'all. Fuck the people that think like that. Fuck every single one of y'all because y'all don't get it. And a lot of y'all will never work in healthcare. Y'all don't work healthcare and y'all never will. But y'all want to tell us how to feel. If you don't work in healthcare, if you don't work bedside in healthcare, shut the hell up on this channel because I will block you. Seriously. Don't tell me how to feel. Seriously. Do not tell none of us how to feel because we are burned out. And we are not getting what we should get at all. So do not ever in your life, in your little life, tell me how to feel because I will block you. That's on your dead grandma. Do not try it. Let me add that in the video too because I just wanted to say that. Well, not me. I love working in healthcare. I love being exploited by the CEO. I love getting a couple cent raises a year. I love just answering call lights up for the whole 12-hour shifts and running around like a slave. I love working in healthcare. Blocked. You will get blocked. Oh, well, we don't have people like you working in healthcare. Because, and then anybody should be able to say anything to you. And people should just be able to just abuse the employees. People should just be able to abuse the call light. Blocked. You will get blocked. You will get blocked. This says I hate working in healthcare. Please don't come here saying being a little pick me, the little pick me that you are. Go play with your husband that's cheating on you. Go play with him, okay? Don't play with me, because I'm gonna block you, okay? Don't tell me how to feel. Bitch, you don't work in healthcare. Do not tell me how to feel. Do not tell me, oh yeah, just deal with it. No, bitch, you just deal with it. Go on Indeed and go apply to work in healthcare. Oh, you won't. You'll stay at the office job. You'll stay at the security. You'll stay at your shit. Yep, you'll stay there because you're not going to work in healthcare, but you're going to tell me how to feel. Don't tell me that you like it because I don't give a fuck. Go Google and go search up people that like it and go under their comments. I didn't ask. You will be blocked. Ashley Unseen approves this message.